Well, you've gone all of the traditional routes, but nothing seems to work for your depression. Well, have you tried TMS, depression therapy? Dr. Stephen Harvey is here from TMS St. Louis. He was recently named one of St. Louis's best doctors by St. Louis Magazine. Thank you for coming in. I mean, every once in a while along this show, we will stumble across something I have never heard of, and this TMS therapy is amazing. He was explaining it to me during the break, and for somebody who's been fighting this battle and has had no luck with drugs, this is a great option. Yeah, now we're talking about severe depression, right?
That's correct. Yeah. TMS is a relatively new technology. It was FDA approved in 2007, and it's improved somewhat since then. So I think right now the technology has improved to the point where there are lots and lots of people who would benefit greatly from TMS, but it's sort of under-recognized.
They don't know about it.
Yeah.
So you have to know where to go.
About it. Right.
Well, what is it exactly? How does it work?
Yeah. Well, TMS it stands for transcranial magnetic stimulation, and it involves using a very powerful magnet, a magnet that's on the same a strength similar to the strength of an MRI machine.
Okay. Which is safe.
Yes. Yeah. Which is safe, and it uses a pulsatile magnetic field. It's not. It's not just like a magnet that you use to pick up a metal thing, but it's a pulse magnetic field, and those pulses of magnetism create an electrical field that stimulates a targeted area of the brain.
And like an MRI, we can target it.
Yes, exactly.
And that's the key, is that you're targeting a part of the brain where this depression lives or can be triggered.
So, sort of, yeah. I mean, the biology of depression is still only partially understood, but what we do know is that stimulating that one particular area of the brain, which it's called the left dorsolateral prefrontal cortex. It's sort of right above your left eyebrow. That treating that part of the brain for a large number of people is curative
effective.
for their major depression.
Now it has a sound that it makes, right?
It does, yes.
And we have a clip of that sound. Let's listen to that real quick.
Let's listen to that.
So it pulses that like a woodpecker almost kind of a sound.
Very much so, yeah. And it actually feels like a woodpecker also.
Really?
Because people can feel that on their head when they're being treated.
But it's not painful.
It's
we
not
don't want to
painful.
frighten people.
Right, yeah, we don't want to frighten people. And for some people it is uncomfortable because it does kind of feel like a woodpecker. Typically it's a little bit uncomfortable with the first treatment, and in subsequent treatments it's no big deal.
Well, that's what I was going to ask.
Person.
If we go in and we get relief, do we get it right away? And do we have to continue this treatment, or is it some permanent fix?
It's somewhere in between. People don't feel better right away. It's a series of about 30 treatments. It's every weekday for the first 20 treatments.
Oh, wow.
It's twice a week after that. Typically, people start to feel better roughly at the 10th treatment. And
but if you're suffering from severe depression, if you've tried everything, going in once a day for treatment is a small price to pay. To get over that.
Exactly.
Get past it.
Yeah. Our patients are very, very good at showing up. They've suffered miserably for year after year. So waiting a couple weeks to get better with TMS.
I almost hate to ask this, but what about insurance? Does insurance cover it?
It does. Yes. Most insurances cover it, or I think a little more than half of insurances cover it.
And you can determine that beforehand for a potential client.
Exactly, yeah.
Wow, that's amazing stuff.
Oh, it's great stuff.
Well, thank you so much for sharing with us.
You're welcome.
Appreciate it. Dr. Harvey's TMS St. Louis is located in Creve Coeur. For more information, you can call them at 1-844-WANT-TMS. That's 844-926-8867, or online at TMS-St. Louis. Is that correct?
Correct. That is correct.
TMS-stlouis.com.